Buddy. I'm Nat Bren, partner at VC23 and Vital Venture Capital. We're an active investor in diagnostics. We're going to try to keep it as informal as we can today. I will introduce, or let the panel introduce themselves, and then I'm going to ask a broad key question, and then we're going to open it up to you all for questions. Like to have as much interaction as we can. If there isn't the interesting questions from you all, I'll keep asking questions and we'll just go with that. But I'd love for you to be thinking about some questions, topics that you'd like for us to focus on, because I look at this as an opportunity really for founders and others to try to learn what you want to learn from this group. And I also recognize we are the thing standing between you and a cocktail later. So we won't go longer than we need to. So with that, why don't we start at the end and introduce yourself, please.
Sure. Thank you, Nat. I'm Diana Saraceni. I came yesterday night from Italy. That's where I'm based. I'm an active venture capital investor, investing mainly in Europe and Israel, but also selectively on US companies, provided that there is a European angle, let's say a CE marking strategy at some point, or some kind of thing where we can be supportive on the European landscape. I have myself 20 years of venture capital experience. I have co-founded 2 investment companies, Diagnosticxs being one of them, a company I have co-founded with another 2 partners 2 years ago, and currently managing a 100 million fund, investing anything from seed to C round stages, anything from $500,000 to 5 leading rounds that are bigger. We led the 20 million rounds, investing in all sectors of medical devices and of course including diagnostic. We have a strong interest in diagnostic, in that in vivo diagnostic and IVD.
Hi, my name is Sherry Griswood. I'm Senior Investment Officer for Foxhill Asset Management. Foxhill is a relatively new single-family office. We were set up a little over a year ago with a mandate that focuses 100% on the life sciences. We're rather agnostic between pharma, device, and diagnostics, more opportunistic, I would say. We do very little healthcare IT, and really look for opportunities that are outside the box in terms of both a technical approach or a novel way in which to stratify a difficult market to make it more accessible. By way of my personal background, I have a science degree but always worked on the street, with about 15 years as an equity analyst, the remainder 15 plus years as an investment banker. I've had as banking clients about a dozen or so diagnostic companies of various types, and over the last 5 years, more predominantly around liquid biopsy or other kinds of molecular diagnostic testing.
Thank you, and I'll just give a quick overview. I'm Nat Bren, a partner at VC23 and also a partner at Vital Venture Capital. Vital invested in life science primarily, some software as well around the country. And it's largely harvesting its portfolio now. We had our first IPO on Halloween, which was a company called Twist Bioscience, so that was exciting. And VC23 is the vehicle to make new investments. And we're primarily investing on the East Coast, but we will look elsewhere. And in both firms, we've invested in 3 diagnostic companies, HealthTel, which is a silicon peptide microarray. It's now part of iCarbonX, which is a Chinese company that was started by the founder of Beijing Genomics Institute, BGI. CD Diagnostics, which is a synovial fluid in the joints, diagnostic company that we sold to Zimmer, who was a strategic partner and investor. and more recently through VC23, a company called Tangent Bioscience, which is an isothermal PCR-based platform for molecular diagnostics of various applications. So I wanted to start off with a broad question, and we can each respond. And then, again, I'd like to ask you for specific questions. But the broad question I'd like to start with is, when you're looking at diagnostic companies, or any companies in particular, what are the top criteria that you look for? We'll hold the question, and it's fine. We just introduced ourselves, so if you could take a moment and provide an introduction.
My name is Mark Pan. I'm a partner at Golden Health Capital, managing healthcare fund about $200 million. We have an office in New York and Shanghai. So we've done 5 deals last year in the US, about $10 million each. One of them actually is IBD.
Great, thank you. So the first question, and we can start this time with you, Sherry, and head down that way. When you're looking at diagnostic companies to make potential investments, what are the key criteria you look for, and what are the things that would be non-turnoffs for you, non-starters, things that would be a problem?
Maybe I'll start with the second part of the question first, because it usually is what comes out in a presentation first. For us, surprisingly enough, the non-starter is as soon as I see the slide that has the hockey stick ramp that goes from 2 million to 9 million to 50 million. And the reason why I say that is in the diagnostics business, unless you are so lucky as to immediately be bought by somebody like Quintiles or LabCorp, getting to the volumes that generate that kind of revenue in a 2 to 4 year time period is completely unrealistic. So the reason why it's a turnoff for us is we believe that management hasn't really thought realistically about the rate of adoption, the cost of business for that adoption, and the training for the marketplace that's required for that adoption. So what do we look for? We look for differentiators, first of all, that have a clear ability to create value in the market. And I'll give an example of how that can be in a difficult situation. You can have a panel, say, of 25 different biomarkers, and a lot of diagnostic companies will talk about the relative breadth of their panel. But at the end of the day, it's not the 25 biomarkers that are going to give you the actionable information. The differentiating company might say, we have the 25 biomarkers, but we've done XYZ analysis, and we know that there's really only 6 that are apropos to what is required for decision making. So it's in terms of expressing that, and it may also be in terms of how the technology is applied. Using old technology to take out new information is a cost-effective way of doing that. Another way is taking a standard methodology and teaching it in a completely different feature sets. So we look for differentiators along those lines. We also are now looking for a higher degree of stratification. It's not enough to say we can find X number of genes, or we can look at this number of biomarkers, and we can take an algorithm and it comes up with a predictive model. We actually want to know what is that going to do for a particular patient base. So what we're using diagnostics for is to better inform a clinical path to success. If we can take a universe of patients and with this new diagnostic have a clearer sense or a higher probability of predicting the client or the patient that will respond, that is something that we think is a high motivator to continue to look at the opportunity. And the third thing that's very important to us is that management understands the market in terms of how it's going to be used either in the hospital or by the doctor, and recognize that if they have to unseat an entrenched system, it's going to take a lot more education, time, and money to do that. So I would say the third key feature is management's astuteness about the general diagnostic space.
Thanks, Sherry. I think you summarized pretty well the way VC investors invest in that space. I would point out that for us, the core thing is data. Of course, in diagnostics, it seems pretty simple. Actually, it isn't. Most of the time, when pitches arise of diagnostic company, they're not the data set presented is not complete. Not because they're early stage, just because of lack of information. I'll come to the point. Most of the time, we can see like sensitivity and specificity, even though very preliminary, because companies are early stage and they will do what is possibly doable in the early days to gather some expectancies. The best expectation they have on sensitivity and specificity, but the lack of information comes from the process, from the standard of care process, so from the information they have on the population they will target. And without that relevant information, you cannot translate sensitivity and specificity in predictive data. So in negative predictive and positive predictive, which is in the end what will matter to the process. So, and that piece of information, I mean, I know it may sound strange to some of you, but in 60 or 70% of the early stage pitches is missing. Early stage companies pitches is missing, which is information that can somehow needs to be figured out and can be figured out without a major effort in amount invested. So it should be done very early in the process. And this is something either we try to figure out the case ourselves within the venture firm, but it should really be provided by the companies themselves. And I know it can vary by geography, sometimes it varies by hospital, sometimes it varies by department in a hospital, same hospital, so it can vary, but it's relevant information to understand if there is or not a business case. And this is where most of data lacks, not in the very specific clinical data most of the time. Thank you.
Yeah, besides sharing in diagnostics, we just want to add that we are more a late-stage investor, so we really look at the management team. We like people who has some sort of track record, and also we like the niche area in their space. We like them to be in the top 2 companies. If it's the top 3, if we give them money, maybe in the top 2. So that's what we're looking for.
Thank you. A lot of good comments indicated. The things I would add briefly, what our group looks for. Number one would be a proprietary aspect, some IP that's not easy to work around. A sales and marketing plan or a distribution partner. Ideally, a distribution partner in diagnostics. There's so many good products out there that it takes so long to get to market without the right relationships. And finally, a realistic capital plan and timetable and strategy to raise that capital. So we've got a lot of comments in terms of things we look for. And in terms of, for my group, the issues that are non-starters, first and foremost would be management team depth. I think it's easy to go out as a founder with a team that isn't filled out because it's hard to fill out a team. But through advisory boards and through people that you can bring on your team that aren't really fully engaged or paid, I think you can do a lot more spade work than you think without really having to have the big budget in terms of developing the team. And even if it costs you significant equity or options to do that, I always see that it's worth it because your chances of success are so much greater. So I have a number of other questions to ask the panel, but I'd love to open it up to the audience and let us know if there are particular questions you would like us to discuss or issues you'd like us to discuss.
So, as we've gone through today with this marvelous speed dating, concept, where else do we meet people like you? I mean, this is not necessarily the best forum. How do deals come to you? How do we communicate? Because three of you sat up there and said things, and they're in our deck. Okay, so we obviously didn't connect with you over the emails or whatever. I take that back. I meant somebody from your company, maybe. But how else do you get the, do they come to you?
Well, that is a hard question. Some of the family office modus operandi is to keep a low profile in a lot of cases, so it does make it more challenging. But occasionally, and especially as it relates to family offices, many times those families may have a particular cause that they are especially interested in as a family. So sometimes you can track them down through advocacy or foundations or related interest in a specific indication. That's one way. Unfortunately, I hate to say it, but sometimes just the social circuit is where you'll run into people that you don't actually expect. But most of the time, because it's important, at least from our perspective, to see a lot of different opportunities, it means that I go to a lot of things like this, or I get referrals from people that I've met along the way, and I keep in touch with a lot of companies that I might have met 4 or 5 years ago that I touch base with periodically. And so I usually keep a stable of companies that have hit my radar screen for one reason or another, and I'll circle back every once in a while, but most of the time it's going to these kinds of events where you get to see a lot of early stage companies together. It's more efficient than trying to search them out on a one-by-one basis.
Yeah, I have to spend a word for this conference because I think the speed dating works fantastically. So if you sit, you prepare with a one-to-one platform. So I think it's definitely one of the best. But there are other conferences where you can hear an investor speaking. That's probably the one thing. And then you can read on press releases who's invested in what and figure out who are the active investors in your space or geographical areas, or when track down press releases of other early stage companies, and you'll find lots of names that you may not have heard of. That's another way to. And there are databases, full databases of early stage companies, and then you just look at the names of investors that are actively investing. That's another way. Go with cold calls. I mean, most of us, I take as seriously any pitch deck that's on my table, independently from the source, but just to the same level. If it's a cold call, just an email that was sent to me with some explanation on qualification, like we managed to gather these people on board as advisor, as investigator, as that qualifies the deal. I don't care if it's just a cold call, somebody writing to me out of the web. It's fine. LinkedIn, and that's another one. I get lots of contact requests on LinkedIn. We want to introduce you to a business, and LinkedIn tells me who do we know in common and lots of things that qualifies the person as well. So it's another way to. It requires a lot of time, unfortunately. It has to be said. I don't know if it's a full-time job, but definitely part-time, 50% of somebody's time to get in early days for a company to get the funding structured. Shouldn't be underestimated, but it's feasible.
Most of our deal actually from referrals. I think find somebody referrals is the best one. We do go to the conference to see quite a bit of companies. The issue for us is, like conference like this, we only can meet maybe like 10 and even less, so that's the condition. We can't see all of them. The other thing when we look for, we are late stage. Although we're working on early stage fund next year, but currently it's late stage, so we look at companies that fit our criteria. That's the most of the company you can see them. But I do talk to them. I do go to the suit. All the posters talk to them. One company we've been talking for 2 years. And then they're doing pretty well. We're probably going to do something. So it takes time. But I think find somebody who fully is the best.
I would add a couple of comments. First of all, I think that the Resi events are actually really high quality in terms of connecting investors to companies. They're some of the best events I've seen. I mean, the fact that they have the online platform to do that That doesn't even exist in a lot of other banks. So even though this may seem difficult, I think they're at the top end of people who are trying to facilitate that. A number of other things are already mentioned. I would add Crunchbase is a free tool that nobody uses enough in terms of founders. I mean, you can go to Crunchbase, you can find diagnostic companies that have raised capital. You can find out who their investors are, how much money they raised and when, and then you can look up those investors and see what other diagnostic companies they've invested in. I mean, it's a way to, in a couple of hours, build a really good prospect list of viable targets. You know, I see so many founders wasting their time talking to investors who aren't in their space. Either they're later stage versus early, or they're not in diagnostics as much, or they're at the end of their fund cycle, or any number of reasons. But I think if you do some really good homework qualifying the targeted investors, then your time will be much more effective when you make contact with those investors. Also, Life Science Nation puts out a database, which is, I don't know what the price is, but we've had portfolio companies that have used it. It's great value for the money. Because I don't think it's astronomical price. It might be tens of thousands, 10,000, 15, 20, I don't know.
7,000 a year.
Seven, hey, it's a bargain, it's seven. I mean, it's up to date. It tells you who's doing what. It's got all the contact information. I mean, the savings of time, that 7,000, it's well worth it. And Rezi and Ellison did not pay me to say any of that stuff. But it's been a long time coming. There were decades where that kind of resource wasn't around. So, how about other questions?
So, of all things, if I send you a deck, what's going to get your attention most? Most important?
Should we answer straight? One thing each?
One thing.
Well,
one
plenty.
thing.
Obviously, the plenty, we said some, but the key thing to me is the addressable medical need. How relevant is the addressable medical need?
The elegance of the technology.
For us, the people.
I'm going to combine my answer. People, because it's already been all of these. So for us, all three of those issues are key: addressable market, elegance technology / IP proprietariness, and the team, or the plan for the team.
It has to be well organized and quickly said. You don't have to want to dig through the whole deck to find that.
Good point.
Well, I think on early stage companies, there's some latitude. We recognize that there aren't sufficient resources to fully flesh out everything. So I advise companies that don't think they have all the pieces, just think about the pieces, and if you present, if I have the resources, this is what I would do with it. That gives the investor or us the opportunity to hear your thought process. And in an early stage company, it's as much about the thought process as anything else.
Other questions? What do you want to learn? What are your next big tasks that you need help with?
Can I add something to the process? Because you can ask how do we identify investor. Can I give another suggestion for entrepreneurs that are raising money? Ask for the feedback and understand the feedback. It's not necessarily right or wrong. I'm not going to have the presumption to say that it's always right from investors. I mean, investors make a lot of mistakes. But if it's understood, you can somehow address it. Because sometimes, and it happened to me several times, I'm happy to say that I was wrong. But I gave straight feedback. And on the other side, which doesn't happen often, the company entrepreneur took some time to prove me that I was wrong. And he came back and said, "You're wrong. this is why you have that misunderstanding, and this is the proof. I spoke to 3 clinicians. You can talk to them, and you are wrong. And I made an investment, and that's part of the job of raising capital. Don't just give up when you're given a no. Now everybody will hate me here because the process of giving feedback isn't obviously always simple. There may be reasons that are more internal reasons in venture capital funds for people, but most of the time it's just straight feedback. We don't share the same conviction on that part of your thesis, of your going to market thesis. So this is where we need to additional proof that helps to go back and make the case successful. So if I may just give that recommendation, because sometimes the process just stops when the funds say no and that stops there. Insist to have straight feedback and address it. Yes.
Well, the key question for entrepreneurs is then to learn which funds give a straight answer and who just takes the easy way out.
In terms of the feedback?
Not all funds give the
Right.
real answer, the real reason why they didn't do it. So that may be something that could
Yes,
be
but
very helpful if you
Well, you have,
just
if
give us straight answers and not
Sure,
just
if
the
you-
easy one, well, we don't think the market is good enough or something generic like that.
Very
that
generic.
You cannot really handle.
But ask for it. It's part of the meeting. Don't just leave there is most of the time there is a first selection that's done on paper. Then we do meet a certain number of those. For example, at Panacus we meet 50% of the companies meet or video call, whatever. 50% of the company. The other 50% are not interested on paper to us. And the 50% that are not interested on paper, they just get simple feedback, which is sorry, we're not interested. We don't give explanation. But the other 50% we meet. We always give explanation, or the reasons why we're not interested during the meeting, because the reason most of the time comes up quite soon in the process. And if we don't, and we're asked to, we think it's something that we give, that's given to the entrepreneur who has spent some time with us. So we actually try to do the effort and get into
Not
the
everyone are doing it that way.
insist, try to get it.
Since we're a small fund, I mean, we don't have a lot of resources, so we have to be particularly focused. And I really do try to say, when I get inquiries, you know, we don't invest in diabetes indications, or we don't invest in CD indications. I try to help company understand that we rule out certain things that we don't think we can get our hands around. With that being said, based on my substantial years in the business from the other side of the fence, I usually will come up with some questions where I think that there's going to be a concern from our part, or where I think we might see that the idea of the opportunity is not been fully thought out. In diagnostics, it invariably comes around the sales and marketing plan or the reimbursement plan, because our experience has been over the last 15 years in this space, when companies fail, they fail either there or they failed in the basic engineering. So sometimes if you get pushback, it's really helping you understand where the pitfalls in the industry lie, and that's a way for you to get a more contextual reason for why the investor might not be interested.
Anything to add?
We usually give answers. If not written, if you give in the chat, we will give you answers. Most of the time is fit question. I don't think. Sometimes would be, you know, the other reason would be we already had one of I'm going to do second one. And most of the time is, you know, either three areas talking about either the IP, either on the track record, either the market, you know, probably we don't feel that they're not big enough, close enough. That's usually the answer. But we do give answers.
I think there's a reason why you don't always get the real answers, because it may seem easy to be a VC versus a founder, but it's pretty hard because you say no a lot. And it's not fun, you know. At first, when I got into this, you know, it was kind of like, it was fun because you're like a movie critic. I don't like that, you know. But eventually you realize, boy, you know, these people have their lives in this. I don't want to disappoint them or discourage them. I mean, we eventually all get to the point where we just don't want to be mean, you know. So you're trying to be nice. So I think if you feel like you're not getting enough real feedback, you should say, hey, listen, don't be nice to me. You know, I want the unvarnished truth of what you think. I have a thick skin, I can take it. Don't worry that you're gonna sound mean, you know, and nasty by telling me everything you think. You know, if you give someone that kind of opening, then they're not going to feel bad telling you, you know, whatever. Maybe it's, I don't think you're a good CEO, or I don't like your personal track record, or I've seen 5 companies go after this and they all failed. And you know, they might say something that's discouraging to you, but if you want to hear the real truth, I think you have to kind of give them that setting where they feel comfortable doing that, because we don't always want to do that. We don't want to discourage people, you know. Other questions, or should I open it? I've got another topic. We can sort of maybe get some people thinking about some other issues. So, you know, in everything we invest in, we're looking forward. You're looking forward and trying to predict anywhere from now to 5 or 10 years into the future. Therefore, we all have to think about the trends of where an industry is going. So what are the trends that you're thinking about now in diagnostics? What are the things that you think about that will impact, that are trends that will impact your future investments?
We're looking in 2 areas in particular. The first area is molecular diagnostics, generation 2.5 to 3.0. We're looking at companies who recognize that there has to be more value created out of a simple array of biomarkers. So we are looking for increased specificity around particular patient sets, so that at the end of the day, the overall burden of failed clinical trials goes down and the productive value of investor money goes up. I'm kind of on a soapbox about how much money has been wasted in clinical trials, and a good portion of it probably on preventable failed trials. So we really look at diagnostics as playing an integral role in improving the overall standard of success for clinical trials. The other thing that we're looking at, and I think that, and that's kind of a trend that's come out of the way diagnostics as an industry works. You get an initial breakthrough of technologies in one type or another, and there's sort of, I'll call it the gross level of putting into use. You go through the recognition that doesn't answer the medical question that's actually in need unless you get to real volumes for a plain simple test. And if you want to get to the next level, the industry goes through a second iteration, usually involved with another technical breakthrough. And then finally on the 3rd generation, you have people to understand how to utilize that technical breakthrough to get at more actionable information. The other trend we're looking at is taking new ways of taking features out of existing data to answer what have been previously unquantifiable questions. The identification and quantification of pain is one of the areas that we're looking at really carefully, where you can actually, we're following, this is a case where we said no to the first company 3 years ago, and one half of the space we came across a second company, gee, that looks like the first company. Well, they're merging, so now we've got a company that we really think has a chance. But we're looking at the trend to take diagnostics to a level of quantifying what was always subjective. Things like pain scores, the MMSE for Alzheimer's or dementia. And I think that we're going to have a trend to better identify patient populations at a more appropriate point in time of care, which also reduces the cost of health.
In Arcus, we're very hard on IVD in general. So anything that's in vitro diagnostic in general, independently from the platform or the technology behind it. Everything that, and in particular in two areas, one of which is personalized therapies. So mainly it's in oncology, of course, but there are trends in other areas as well. And the other area we're very keen, because it very much comes back to the point of quantifying, less quantitative data is CNS, central nervous system, so all the pathologies of the central nervous system basically have little quantification in general, and biomarkers there, we think is going to be they're going to be game changers in the identification of pathology in the early days, whichever one. I mean, Alzheimer's is a big thing, and others as well. So these are the two areas where we're very hot. But we recently invested in a company in endoscopy that basically solved the problem of incomplete colonoscopies with a very simple device. So it's not IVD, it's not even in vivo diagnostic, it just helps the comfort of the procedure of colonoscopy, which is mainly diagnostic. It can also be interventional colonoscopy, but most of the time it's a diagnostic procedure. And that is part of what we also do. So, I mean, hard on IVD, but it also invests in other subsectors.
We currently looking at precision molecular diagnostic, that's the area, especially with companion diagnostics. We're not a specialist in IVD area.
And our group is focused on a couple of trends. One is technologies that are now enabled by next-gen sequencing. Whether it's like in molecular diagnostics, we can now sequence species and subspecies of bacteria and develop diagnostics knowing that information. And also the trend out of the lab into the provider's office and even into the home, which we're interested in largely because we know the acquirers of diagnostic companies are interested in. So other questions?
How closely do you manage your exits? I know we've been talking about a very, very specific, amazingly thin, I would think, part of the healthcare diagnostic market. Oh my God, I don't know how you even find 3 companies that are doing that. But I guess it's what you do. Once you get into an investment like that, do you just keep riding it, or how do all of you even think about exits? Is it active, or you're just in the investments, and if exits happen to exit at some point, then that's a passive thing?
Well, from our perspective, it comes down in part to valuation. We believe if we buy right, we can weather what it takes to go in between. Now, with that being said, we're a relatively new fund. We've only been around a year. So we haven't even really figured out what we need as a time horizon. But I will tell you that what our strategy at the moment is to balance some of the private investments with public investments in order to have capital to turn over. And that would allow a longer holding period for the private company. But we basically feel that if we buy the right opportunity, we can hold it for, and diagnosis is primarily an acquisition. It's rare that you're going to hit somebody that's going to grow up to be another LabCorp. So it's almost always an exit through a collaborative partner of one type or another. That's different than some other areas of the market.
To clarify, we always think of an exit before the investment, of course. What are the potential buyers, if they are acquisitive, what are the multiples on the market, and what is the company eligible for an IPO under the good market condition. All these questions we address them, and they have to be positive before investment. But the people in charge for keeping for the exit option for the exit actually are the team members. Primarily the CEO is the one talking to the strategic, and we always recommend that the discussion would start early in the process, in 2 or 3 years in advance, because you have to build that relationship and understand who is interested exactly in what, and engage the strategic as early as possible. So that's our recommendation. But the exit process is driven by the company itself, not by us as investors. Yes, we do participate, we have connection, we have network, we help, we support, but coordination is done by the company. If this, I don't know if it answers the question, but
That's good, because you're quite different. You know, you're in for the long haul, although you're just a year old now. But it sounds like you buy and hold. But you're more proactive. Before you make the investment, you're deciding how you're going to get out, which is what I would
well,
expect.
we double check that there are options to get out, of course. That's, I think we'll do, right? It's like, who are the potential buyers? Are they acquisitive in general? Then the picture may change down the line,
Sure.
5 years after, but at least we have done homework.
I'll give you an example. I mean, a number of years ago, and going back a lot, like 25 years ago, MRI was like a new technology. Everybody invested in mobile MRI scans. Well, that experience proved to be an economic catastrophe. So anybody that comes to me with an MRI-based technology, the first thing I think about is, this isn't probably going to have an exit in my lifetime. So, you know, prior experience and how the industry has experienced cycles before helps guide what we think of where that company's positioning is now.
The things was always reverse. That's how we do it. So typically, you know, for our firm, typically see, preferably we like the company's IPO, but sometimes we are willing to do it if we had somebody who's willing to buy it. You know, so the worst thing that happened to us is stuck to it. So hopefully we plan, hopefully work out.
And our firms, my two venture firms, we invest in 24 companies. We had our, and this is over 10 or 11 years, we had our first IPO last week. So, you know, but we never plan on an IPO exit, ever. I mean, it's just, if that happens, it's wonderful. So every other company we've exited, and we've had, I don't know, something like 12 or 13 exits already, still some in a portfolio, you know, all strategic acquisition. We also think about the exit before we invest, and even a step beyond, which I would bet most of this group does as well. We ask the CEO and the founder team, what's your game plan? You know, how long do you want to be in this? Who do you want to exit to? Have you thought about the players who are going to be on your exit list? You know, it tells us a lot, because ultimately we're getting married, right, for a number of years. And we want to know, do you want to get out in 2 years? Do you want to be at this for 20 years? You know, is this a lifelong endeavor that you're going to go to your grave building this company? So we want to know your time frame. We want to know how much capital is going to be involved in that time frame. Because the last thing we want is to invest in a company where you want to be in it for 10 years and we wanted to be in it for 4, you know. But we also want to know, you know, have you thought about who you're building it for? I mean, ultimately, a lot of investors talk, and I think it makes sense. You know, you don't invest to hope to sell a company. You invest to build a profitable business. And if you build a profitable business, someone will buy it. But, you know, ultimately, you're taking money from investors who want it back. So, you know, I think it's really important for you to think about who you're going to sell your business to. It's a wild guess, but, you know, have an answer, because if you don't have an answer, that's an immediate turnoff. It's like, oh, I have no idea who this guy's going to sell it to, and I'm not, whether he's thinking 2 years or 10 years, I'm not going to invest. Why do I want to get, you know, they don't know where they're headed.
We kind of ask the question from a different viewpoint, and I will ask very specific questions about the competitive landscape, and I will ask questions about how does your product development timeline fit with your competitors, because what entrepreneurs typically think is sort of in a tunnel vision, and they forget that their competition could be moving 2 or 3 times faster. So we get some of the same points that Matt makes, but we make it through a competitive landscape viewpoint. If the management doesn't really have a really good grasp and I call it peripheral vision about what's going on around them, then we don't feel so confident they'll know how to get the company positioned for an exit.
Yes.
A lot of discussion about exits. Where do you find your deal flow from? Intake?
Somebody
Do you
asked the
deal with
question.
accelerators? Do you deal with incubators? Do you deal with referrals?
We touched on deal sourcing earlier, but is there anything to add? You start down at your end.
Already, most of it's referrals. So, we do go to conferences, meet people, visit incubators. But I think the best deal are from referrals. We've done 5 deals last 2 years, and we actually had 2 IPOs this year.
What?
It's different. I'm late to be honest. You can be there for
That's
10
true.
years. My LP won't let me do 5 years. So.
And Diana mentioned earlier, LinkedIn and referrals. I would agree. I mean, if you can use LinkedIn or some other source to find somebody who knows somebody at a venture firm you're going to want to talk to, it's so much to your advantage. If I see a deal that's brought to me from someone I know, I'll definitely spend more time on it. I don't know if you all feel the same way.
To a degree, but to go to your question about incubators, this may be not a great thing to say, but we look at companies out of incubators more to get a look-see on competitive technology because it's a little earlier stage than what we typically invest in. So I don't normally source deals from incubators, and I don't source deals through bankers, since I was one for so long. So for me, I actually do a lot of outreach based on technologies that I come across through publications, through industry press, through asking the competitive intelligence questions, rather than incubators specifically. But these kinds of events, as we mentioned earlier, I also like to say that the quality of companies and the quality of investors now coming to Resi has improved a lot over the last few years. So we find this type of event very efficient for us. Or we go to academic meetings like SITC or the gene and cell therapy meeting that's not quite huge, but enough so that we can see a lot of companies and walk up and down the poster line and see who's developing what.
One last question.
I actually wanted to just add something to that, because I had somebody do this, and I just thought it was great. Met a small company that was not for us. We kind of basically said, you're really not for us, it's not in our space. That gentleman called me and said, hey, I ran into this company I think would really fit well for you, right? I remember this guy's name, so when I find somebody that will fit for him, I will go out and do that for him. So sometimes the best way of building a network is doing good for others.
Good point. Good point. So I think we're out of time, unless there's any last minute questions. Another minute? Okay. Well, I'd like to thank my panel, and thank you.